Well, good evening. We're glad that you could find time to join us live from our studios in Mombasa. And today we'll be talking about matters cancer. And with me here in studio is Dr. Anisa Mburu from the Aga Khan Hospital here in Mombasa. And she is a gynecologic oncologist. Perhaps maybe to start off this conversation, Daktari, just bring us up to speed. What exactly does a gynecologic oncologist do?
Thank you so much, Kevin, and thank you for having me. As a gynecologic oncologist, I am a specialist in women's cancers. These are the cancers that affect the female reproductive system, and this includes anything what you see on the outside, the external genitalia, going all the way to the cervix, the uterus, fallopian tubes, ovaries, as well as a condition called gestational trophoblastic neoplasia, which is a particular group of illnesses responsible, or rather that come about because of pregnancy states.
So you're saying that the area of focus is around women. How is the situation in the country?
Well,
as far as you know, those women who are suffering from cancer is concerned.
Yes, unfortunately, we are having a lot of women coming in with these cancers, and over the last, say, decade, we're seeing a rise in these cancers. I'll take an example of cervical cancer. In the world, in Kenya, we're seeing about 5,200 women who are affected annually. And out of this, in the Mombasa area, we have about 1,300 women who have been diagnosed with cervical cancer. And unfortunately, out of this number, 3,000 are the ones who die from it. And so the burden has become so bad, and we are seeing even other cancers that we thought were mostly in the Western countries. For example, endometrial cancer. This is the cancer of the inner lining of the uterus. Before, we'd see mainly in affluent women in the Western regions. But right now, because we're having a lot of dietary changes, lifestyle changes, we're having a lot of women coming in with endometrial cancer, which is actually killing them.
And which is the leading type of cancer in the country right now?
Right now, the #1 cause of morbidity is breast cancer. But when it comes to death from cancer, is cervical cancer. Yes.
And as experts from the medical profession, what do you think are the causes of this disease, especially cervical cancer?
So when it comes to cervical cancer, we are looking at mostly the human papilloma virus, which has been shown to cause at least over 90% of the cancers. And with this particular virus, it's a sexually transmitted infection that is the commonest in terms of STIs. But then usually women will not know when they have it, they'll not have any signs or symptoms, and the body just clears it without them ever knowing about it. And that's why they end up developing cancer because they take a long time before they discover. And when it comes to that kind of a situation, we want to be able to screen these women as early as possible. And this HPV doesn't work alone. As I said, a lot of lifestyle and diet changes have also impacted our ability to protect our bodies very well against these types of cancers. For example, we're eating a lot of processed foods, as in it has become so easy to just call up and order for a KFC or pizza or something, you know, compared to just going to the kitchen and making some plant-based foods, which are very nutritious. This kind of dietary changes have really impacted our body's abilities to fight these infections. And it has also been seen that in Kenya, about 86% of people have a sedentary lifestyle. It might be a mama mboga or a kiosk owner. They'll come in with their wares, they sit down the whole day, and they will not be moved. So this inability to keep an active lifestyle has made a lot of people have a lot of obesity, other non-communicable diseases, and it has become quite rampant.
So we can say that it has a huge impact, especially on women here in the country.
Absolutely. Because at the end of the day, we find that the women who are affected with these cancers, they're in the prime of their lives. These are 20, 30, 40-year-olds who should be working, providing for their families. Most of them have young families, and so they should be able to be working towards the social economic development of Kenya. But most of them, they're sick, and we all know that cancer is a very expensive disease. So instead of being productive for the country, they end up spending so much time in the hospital, and the worst part is they die from these diseases.
How much does it cost to treat cancer? Just to roughly estimate.
Oh, that is such an excellent question, and it is for a normal mwananchi, it can cost north of 500,000, and so it's not cheap. And even by the time you start from the diagnosis to the test to say the chemotherapy or radiotherapy, it's expensive, and it can go even over $1 million. And you see all the time, we'll see on social media people asking for funds and everything for 1 million, 2 million, and it depends mostly on the kind of cancers, but they're all very, very expensive. The drugs are very expensive.
Well, there's obvious need for sensitization and campaign against dealing with the scourge in the country. And I understand that January is the cervical cancer awareness month. What are some of the key takeaways, the interests that as a country, as a government, they need to consider in order to deal with this disease?
Yes, we have just come from January, which is Cervical Cancer Awareness Month, and if there's nothing that people take away from this, there's just 3 main things that I would love, like the country, the government, everyone to focus on. Number 1, we've said it's caused by a virus. This virus, there's a vaccine that can protect people from getting or rather when they get the infection, they can actually prime their body enough to protect themselves against developing cervical cancer. HPV vaccine have been made free of charge to all girls and boys 9 to 15 years. So mostly not the girls, we're having a bit of an issue there. But the girls can get it free of charge from most hospitals between 9 and 15. And the point is that before they become sexually active, they are able to boost their immune system so that by the time they get the HPV, which they definitely will, because in a woman's lifetime, 80% of them will get the HPV. And so we can vaccinate our young girls against cervical cancer.
At the age of 9?
At the age of 9. So
what you're saying is that a girl can get cancer from as young as 9 years old?
So the point of the vaccine is mostly to boost the immune system so that they can be able to fight the virus once they get it. But cervical cancer can occur even in young teenagers. The youngest patient I've had to deal with was 16 years old, and she had advanced cancer. And the kind of treatment we had to give her, radiotherapy, it completely damaged her reproductive system. And so it's not just a disease that we see in the 6th or 7th decade of life, but it can happen as young as these women if they start having intercourse as early as the Kenyan sexual age of debut is about, 9-11 years. So when young girls start having intercourse very early, they expose themselves to this virus.
So out of this data that you've just given us, I think you said 1,800 cases of cancer here in Mombasa. Are we able to identify in terms of the age group, especially among the teenagers, how many are they in this group of 1,800, those who have been confirmed that are diagnosed with the disease? And of course also, if you are able to tell us out of the 300 that have passed away as a result of cancer, can you get the data and information so that we can be able to also tell our viewers and the public about this disease?
Yes, so as it stands, there are several studies ongoing, and we have the national database and even hospital-based registries that are recording these figures. And so if we can speak from the perspective of, say, Aga Khan, Mombasa, we're seeing a lot of young women between 30 and 40 years old who are showing up with this kind of cancers. And so that's why we're really trying to stress that for these women, as long as you're 25 years and above, you need to get screened for cervical cancer, because the virus that we talked about, it causes some changes in the cervix that when they left untreated, it becomes cervical cancer. But if we screen a woman, we test them for the virus, then we can do other additional tests to confirm whether they have the changes that the virus has caused, which are called precancerous changes, and we can even treat them before they develop cervical cancers.
And are women able to protect themselves or prevent themselves from getting this disease?
Yes, as I said, for generally, in terms of all cancers, we find that lifestyle and dietary changes will protect women or even men from 30 to 40% of the cancers. And this means that you have an active lifestyle, you make sure that your diet is well balanced, we avoid a lot of the processed foods. When it comes to the women's cancers, I talked about endometrial cancer. It's one of the main causes, or rather it's caused a lot by poor lifestyle choices in terms of having a lot of overweight or obese women. So if your lifestyle is well channeled to protect you against that, it can actually help. When it comes to something like cervical cancer, the HPV, as I said, does not work on its own. So there are some things we can do to protect ourselves. For example, smoking. The one thing about smoking and cervical cancer is that someone could have smoked even, say, in their college years, 10 years ago, and they stop, but within 10-15 years they still develop cervical cancer. So smoking, other activities like having multiple sexual partners or having a partner with multiple sexual partners, it ends up increasing the risk of cervical cancer. Of course, if you have any immunodeficient disease like HIV, you've had a renal transplant, you make sure you're taking the medication so that you reduce your risk against these cancers.
There's also the issue of stigma, which I really understand is a big problem amongst those who are suffering from cancer. What are you doing as health professionals, or that's those people who are involved deeply in this particular issue? What are you doing to save those who probably think that once getting the disease is as good as, you know, signing a death sentence?
Yeah, and this is something that we deal a lot of, because most patients will be like, or most people will be like, why should I be screened? Because I'm healthy. Why should I go to the hospital? Or even if I get the cancer, I'm going to die anyways. And the key thing that we're trying as healthcare workers is to tell people, you know what, yes, we have this group of diseases, but we can screen you for some of them and actually diagnose it and treat it early. And also we're trying to raise awareness, reduce the stigma against this kind of cancers. I know they've been associated with things like witchcraft or just bad voodoo or something like that, and we want to help people understand the cause of these illnesses, how to protect themselves, and even at least seek good healthcare so that they're able to fight these infections and cancers.
Despite these services such as screening being available in health facilities, I understand it could be probably hard for anyone to just come and, you know, go through a screening process. What are you able to do to convince them to just come out, because it's something that they might not know they do have, but until they go see a doctor, what do you do just to reach out to many of the women?
So one of the things that we really want to capitalize are people like yourself, the media, because when you put out the message that we have these cancers, they can be treatable, and you just need to show up at a hospital, it will reach a lot of people. As healthcare workers, as people in the public health, we try to raise this awareness. We do community health drives or outreach camps where we try and educate these women, even men, so that they can learn about these cancers. And of course, one of the societies I belong to, the Kenya Obstetrical and Gynecological Society, we launched several videos in multiple languages that are available on YouTube discussing cervical cancer, so that they can be able to, different people from different ethnicities, different tribes, they can be able to hear and understand what is happening and be able to seek this treatment. Another thing is, just when you're having conversation with your friends, always end with that part, you know what, have you had your annual checkup this year? So that we can make it a habit. It's part of our system that we always get checked.
What are also some of the initiatives that you think perhaps need to be employed to ensure that those who are coming from vulnerable backgrounds, we're talking about people who are suffering from cancer deep in the villages, they cannot access or have access to modern equipment to screen and even treating this disease? What are you doing to reach out to those women who are suffering from cervical cancer?
I admit that has been one of the fight and one of the things that we're really struggling with right now. And this is a call to action to especially our government, because if we have centers like early detection centers put in our rural areas, this can improve the detection and early treatment for these cancers, as well as the kind of county hospitals that we have at this moment. We should be able to provide this kind of services. And so attention has mostly been to the local towns, the very high economic end towns, so to speak, like Mombasa, Nairobi. But we need to draw focus to Lodwar, Turkana, this kind of counties where even healthcare professionals don't want to go there because they know they're probably not safe, they're not having transport, they're not having clean water to drink, they don't even have a place to stay. No one will want to work there. But if we create hospitals, the government to fund these hospitals where the people are at, we can actually improve our chances of fighting this disease. And apart from that, we have a lot of doctors who are in the county hospitals, and they would want to subspecialize into this kind of oncological practices. So the government should be able to release these people to go for training and absorb them back.
I was actually coming to that. Do you think there's synergy between, those who are running, health institutions from the national government, the county government, and the health professionals? Is there a synergy between them?
Yes, and this is quite evidenced by the National Cancer Summit that has been ongoing in Nairobi right now, because we have the national government through the National Cancer Control Program that has networked with a lot of societies, a lot of individuals in this kind of issue that you're discussing. So they're creating awareness, they're doing a lot of camps, screening, and even there's some hospitals being opened. I was glad to see Garissa, they've opened a cancer center, and so there's things happening.
So such kind of initiative should be replicated across the country.
Absolutely, and on a large scale, so that we improve large-scale population-based screening for something like cervical cancer.
Dr. Speaking of the theme of this year, World Cancer, there is closing the care gap of this disease among women. What is a reflection on that?
So this particular theme has been running for about 1.5 years now, and the thing about it is that we've noticed there's a lot of lack of awareness and education amongst the people, and that's why we're trying to change this in order to have more awareness, education, the right information being put out there, so that we have at least the people can be empowered to be able to say, you know what, I can come to hospital, I know which hospital to go to, which kind of care I need, and be able to come and actually seek the services. The other thing is about more like what I was trying to say about community outreaches. We as healthcare professionals, we should not just stick in the big towns. We should take it upon ourselves to go through, to reach some of these outreach centers, some rural health facilities that are really hard hit by these cancers, and we can actually talk to them and educate people, train people, so that we can be able to increase sensitivity and awareness about these cancers.
I don't know if you have some data regarding how the situation is across the country. You've just talked about 1,800 cases here in Mombasa. Are we able to perhaps know which county in Kenya has the most, reported cases of cancer, and what is the government and those in the health sector doing about it?
So in the national registry, cancer registry, it has been shown that especially in the western countries, western region of Kenya, where there's a high prevalence of HIV, it has one of the highest prevalence of something like cervical cancer. And so when we are able to identify something like this, it's now the government has been trying to improve HPV testing, which is the main screening for cervical cancer test, and we're also trying to do what we call colposcopy services, which are diagnostic for cervical cancer. And in terms of actual numbers, I think I'll need to consult the national registry better, but we just have the broad number of the 5,200, and these are the ones who actually come to hospital that we know of. So imagine the people in the rural areas who have no access to someone like my specialty. So there's probably even more who are dying out there.
Talking about this disease, there definitely must be impacts, the economic impact, and having women at the center of this cervical cancer. How huge do you think the impact is when a country is reporting such rising cases of cervical cancer?
Yeah, especially right now when everything in the world is just, the inflation rate is just crazy, and then you have the young, able-bodied people who are supposed to be out there building the nation, not able to do the jobs, not able to build themselves, and not take care of their families. This has led to a very big socioeconomic impact to Kenya, because you find that the amount of income that these people are able to generate is much less. We're having a lot of people being pushed into poverty because to access this cancer care treatment, radiotherapy for example, a woman will have to go sell her farm, sell maybe a cow or something that is the main source of livelihood for her. And this in turn leads to a high rate of poverty, homeless people, as well as orphaned children. And then we have a lot of street children who are also impacting negatively on the economy. So it is a socioeconomic crisis, and we need to stand up and take note.
And what are the symptoms? So
when we come to symptoms of, say, cervical cancer, you'll have someone presenting with bleeding, and this could be abnormal bleeding when it's outside the menstrual period, or it's a woman who's already stopped having her period. She's going through menopause and she develops abnormal uterine bleeding. A foul-smelling vaginal discharge and even pain can occur to signify cervical cancer or even sometimes endometrial cancer. However, by the time the cervical cancer is showing up with symptoms, it is going to be very late, unfortunately, for most people, and that's why we're trying to screen women and test them with the HPV DNA testing so that we can improve the uptake of screening and prevent those symptoms coming. However, we do tell women, as long as you even have any one of those symptoms, seek care, because sometimes the disease has not spread so much, and we can still initiate some therapies like radiotherapy and actually give you a chance for cure. When it comes to something like ovarian cancer, it is very non-specific, and most of the time the woman will just notice that she's having increased weight around her abdomen. And this is because of a lot of fluid in the abdomen or even the ovaries, which have become enlarged. And so most women will just think, you know what, I'm getting a bit fat around the middle, and they will ignore the symptoms and not come to hospital. Most of us tend to have a lot of indigestion, constipation, and we don't think much of it. And sometimes there can be an underlying cause, which is the ovarian cancer. And the other thing that I really find most women are not aware of are the diseases called the gestational trophoblastic neoplasms. We have a high number of women who go through miscarriages, and whenever they have these miscarriages, they can go to hospital, get treatment, and then they go away. But now the problem is a few of them will continue bleeding even after they've received treatment, and this means that some of the tissues that had remained have become cancerous, something called choriocarcinoma, and it's one of the 100% treatable cancers of the female genital system. And so I advise for any woman who's gone through a miscarriage, please, within 6 weeks, if you're still bleeding, make sure you come to hospital, repeat a pregnancy test, and we make sure that you're protected.
And as we wind up, from where you sit, do you think as a country we have enough specialized doctors who can be able to adequately deal and advise accordingly about this disease?
Unfortunately, that is the one thing that we're really suffering again with, because, for example, gynecologic oncologists, we are only about 20 in the entire country, maybe even less. And so we need more skilled healthcare workers who are specialized in oncology so that we can be able to manage these patients. In Mombasa, we're only, I think, 2 of us. And you see, we need more people to specialize, and there are these courses that are available. So we just need people to take it up, get trained, and be able to join the fight.
And Dr. my final question, what is your message to the people of the world, especially on this World Cancer Day?
So one thing I want to say is that World Cancer Day does not have to be only one day, February 4th. World Cancer Day is literally every day of your life. You want to take care of your own self, take care of your health, watch your lifestyle changes, things like smoking, alcohol. You need to at least live a healthier life. For women, please get screened as early as you can, as regularly as possible, and please let's vaccinate our young boys and girls with the HPV vaccine. Thank you very much.
Well, thank you so much, Dr. for that in-depth analysis about cancer. That was Dr. Anissa Mburu from the Aga Khan Hospital here in Mombasa, who's just given us an in-depth analysis of how the cancer situation is in the country, and in this specific subject, the survey called cancer. And of course, also we'll be delving more into having this conversation, and we'll be highlighting and bringing up to speed our viewers on exactly what needs to be done, the interventions that needs to be put in place by the government, and of course also talking about both levels of government and as well as the health workforce in the entire country in order to help women suffering from this scourge. That's it from Mombasa. I have been your host, Kevin Mutai, together with my team here in Mombasa and in Nairobi. Thank you so much for watching. Until next time, adios.